What do I need to know before I take my baby home?
We know how excited you are to go home with your new baby, and we are really excited for you. Before you go home from the hospital, it's really important that you have a pediatrician identified for your baby and that you have your baby's first appointment scheduled. Your treatment team in the hospital will recommend when you should first see your pediatrician, and it generally is in the first few days after you leave the hospital. Your pediatrician's office will also have a phone number that you can call day or night with any questions about your baby. So it's really important that you know what this phone number is, and I would recommend putting it in your phone so you have it whenever you need it. There are a few things to pay attention to when you take a new baby home from the hospital. Perhaps the most important thing is that a fever in a new baby is an emergency. That means that if your baby has a temperature of 100.4 or higher, you need to go straight to the emergency department. Because of this, it's important that you have a working thermometer at home. Your baby will need to eat about 8 to 12 times in a 24-hour period, which generally means they're eating about every 2 to 3 hours. Your new baby shouldn't go more than 4 hours between feeds, so if they're sleeping and pushing that 4-hour mark, it's important to wake them up and feed them. Your baby should also have regular wet and dirty diapers. Your baby's stool should be any natural color, so anything yellow, green, or brown is totally normal. You'll also want to monitor your baby's skin to make sure that their skin doesn't start to look yellow or that they're not looking jaundiced. If your baby is too sleepy to eat, if your baby is starting to look a little bit yellow, or you're worried your baby isn't having enough wet and dirty diapers, you should call your pediatrician for more advice. It's important that your baby sleeps on their back in their own separate space without any loose blankets or stuffed animals around them. And it's also important that they always travel in a car seat facing backwards. If your baby has neonatal opioid withdrawal syndrome, they are going to need a few extra things to help support them after you go home. Your baby might be having some mild symptoms of withdrawal when you go home. It's really important that you tap into those skills that you learned in your baby's hospitalization about how to create a healing environment for your baby, because this will really help you even after you go home. Your baby's main issues will be difficulty with eating and sleeping. So if you are worried about your baby's eating and sleeping patterns, you should call your pediatrician and talk to them about any questions that you might have. Your pediatrician will become a trusted ally in the care of your child and often becomes part of your family. So it's really important that you find someone who you trust and that you know that you can ask them any questions at any time.
You can do this. Keep these things in mind. Do your best and enjoy the time you have with your baby.